Now Amanda is going to demonstrate exercises that you can do immediately post-pregnancy. If you're recovering well from your birth, whether it was a vaginal birth or a C-section, these exercises could be useful for you to start doing within the early days and weeks postpartum to help reestablish the connection between our core, our pelvic floor muscles, and the whole body. So Amanda is starting on her back. We are going to bend the knees, place the feet flat on the floor. Perfect. And she's in a neutral spine position. So the rib cage is just soft and down slightly. And we have a gentle arch, a gentle curve through the low back. I'm gonna get you to untuck your pelvis just a tad. Perfect. So her glutes are nice and relaxed. She's not squeezing and tensing her bum. And then for now, the belly is nice and relaxed as well. We have a long spine. So for Amanda, I'm gonna have her place one hand on the side of her rib cage, right up here, perfect. And then her other hand on her lower belly. We are going to do a connection breath. So in the connection breathing, hands are on the body so we can feel where the breath is going. On her inhale breath, she's gonna feel this nice air filling up into her rib cage and into her belly. So right into her hands where they are. Exhale breath, she's gonna feel her rib cage come back in and down slightly. Belly's gonna fall down and relax. Let's do that again. Inhale to inflate. Exhale, deflate. We're not forcing the air anywhere. We're just sending it gently into the hands. Inhale to inflate. Exhale to deflate. Once she gets more comfortable with this pattern of where the breath is going, we're gonna start to incorporate more focus into the pelvic floor muscles. So she'll take an inhale breath and almost feel like she's sending air into her pelvic floor as well. She feels like her tailbone is softening into the ground underneath her. Once this is comfortable, then we can add a gentle contraction or a pelvic floor lift. So again, inhale breath, we inflate and relax. Exhale, she's gonna just gently draw her pelvic floor up and in. And we do that by simply feeling like the vagina and the anus are closing and lifting upwards. This happens without squeezing your bum. So let's just relax your pelvis again a little bit. Perfect. So nice inhale, breath, inflate, relax. Exhale, gentle contraction, and she'll feel some action happening through her abdominals just by simply exhaling and getting a bit of tension in the pelvic floor. So this is what we start with immediately post-pregnancy, the connection breath. From here, arms are gonna go to the side. We're gonna carry this breath with us through the rest of the exercises. We're onto a glute bridge now. So we'll pull the heels back into the body just a tad. Perfect. Feet hip width apart. Let's move them apart maybe just a tiny bit. Great. We're still in this neutral spine. Ribs are down and in, just gently. Bum's not tucking under. If her bum was tucked under, it would look like yeah, so this is what I would call untucked actually, so that's perfect. Bum's untucked here, and bum's tucked when she flattens her back. Perfect. Pulls her tailbone under. We don't need to be in that position. You might be in that position a lot if you're postpartum now, sitting. So we get back to neutral. We just have this gentle curve. The glutes are relaxed. The rib cage is relaxed. So we're back to the connection breath with the glute bridge. We take an inhale. Exhale, she's gonna squeeze her bum. She's gonna lift her hips. Perfect, nice, right to there. And then inhale, she's gonna come immediately back down all the way. Kept that neutral spine, didn't tuck her bum under, and we're gonna flow back through. Just to there, we don't need to go super high. We're keeping the ribs down in line and back down. We'll do one more. So she's exhaling, she's lifting, we're staying neutral. We have a bit of tension in the abdominals just from exhaling and all the way back down to the floor. The next exercise is supine heel slides. Supine, just on the back. Heel slides, we're gonna put the hands on the hip bones, fingertips, perfect, into those abdominal muscles just gently so you will be able to feel some tension happening. So from here, again, we take the exhale breath, we're gonna slide one leg straight out. It's going to hover just above the ground. Inhale, pull it back in to the starting position, and we'll alternate sides. So exhale, slide out, hover, and back in. We'll keep going there, Amanda, for a couple more. So what she's feeling is a stable pelvis. It's not rocking and shifting. Her lower back isn't flattening and arching off the ground. She's kept this really great alignment through this exercise. So we exhale to extend. You're immediately going to feel tension in your belly. And then inhale, we place the foot back down. So this is great. We should note in this exercise, when we're doing the exhale breath, you don't necessarily need to do that pelvic floor contraction. First, we just want to work on integrating this breath with the movement. Once you feel a little bit better postpartum with just the breath and how the movement is feeling, you can start to do a gentle pelvic floor contraction through the extension of your leg. But make sure on your inhale breath, you're feeling that relaxation of your abdominals, your core, your pelvic floor, so you're not holding tension in your pelvic floor muscles the whole way through this set. And the last exercise we'll do is a clamshell. So we're gonna roll to your side. Really important that we just roll straight over. Support the head with the hand. And then in this position, we have the head, the hips, and the heels in one straight line. We're rolled forward slightly more than you might think you need to be. We're gonna place the top hand on the top hip or the top glute, maybe down. Perfect, just here, because we want to feel this hip stay completely stable. Heels are going to stay together. We're back to our connection breath. On the exhale, we're squeezing the top glutes to lift the knee. The range of motion is quite small. We feel tension in the bum here. Inhale, it goes back down. Exhale, squeeze to lift. Totally stable. And I'm just gonna pull Amanda out of this good position. I don't want her rocking backwards and forwards through this exercise. I just want her to stay completely stable, hips forward, nice little curve in her lower back. And then that inhale, we relax. Last one, exhale, squeeze and lift, small range. Inhale, leg returns down. So those are our exercises that we should be doing immediately post-pregnancy if you are recovering well and want to start integrating your core and your pelvic floor back to better health. In this video, we're going to discuss exercises that you should avoid immediately post-pregnancy. These exercises can simply place too much strain on your core, your pelvic floor muscles, and can make your recovery last so much longer and cause additional issues to the body that we want to avoid. So we rehab really well post-pregnancy so you can get back to all those exercises that you love to do faster and more successfully. So avoiding these exercises will really help you to recover faster after your pregnancy and get you back to lifting in the gym and doing all the exercises you love to do again sooner. So the first one we're going to discuss is high impact exercises like running, sprinting, jogging, jumping. We want to avoid those post-pregnancy in those early days, weeks, months, so the core and the pelvic floor can regain the tension to be able to stabilize your pelvis, your hips, your low back, so we don't cause an injury or an issue. And especially because we want to avoid injury and issue to the pelvic organs. And there's just is lacking stability in those connective tissues holding the pelvic organs in their place. High impact activities can cause a lot of downward pressure onto the pelvic organs, and that could potentially cause greater issues like pelvic organ prolapse. So avoiding high impact activities post-pregnancy is really important. Waiting till we've rehabilitated the core and the pelvic floor is what we want to do instead. So we often think that we need to do a lot of abdominal exercises post-pregnancy to get the core back in shape. There can be a lot of pressure to fit back into your jeans or get your abs back after pregnancy. And traditional abdominal exercises are actually not the best course of action to getting our abs back. So an example of this is something as simple as crunches and sit-ups. This is often what you will see in postpartum post-pregnancy abdominal workouts, and we want to avoid this because it causes the belly to actually bulge out and up, which is not often what we want to do post-pregnancy. We want the belly to be coming back down and getting flatter. Not only will the belly be bulging up, but we also place greater downward pressure and strain, again, onto the pelvic organs. So Amanda's setting up for a crunch here. What we're going to see when she crunches and sits up is this bulging in her belly. The abdominal muscles are popping up and out. This is placing strain on the abdominal muscles. It could be causing her diastasis recti, her abdominal muscles, to separate and split even further apart, causing damage to her connective tissue. So we want to avoid those traditional abdominal exercises like crunches, sit-ups, even double leg raises, or exercises where you're jackknifing or tucking the knees in and out. Any exercise where we're getting a lot of this bulging and pressure in the belly and also downwards into the pelvic floor and pelvic organs as well. And that might just feel like pressure, almost like you're going to have to go to the bathroom right away, or that there's air leaking from the vagina, or just simply that you feel pain or pressure in your sacrum or your low back, your tailbone. Another abdominal exercise variation that we want to avoid immediately post-pregnancy is where the belly is towards the floor. So if we roll over to the front here, an example of this is a front plank. Again, something very common that you would see. Yeah, and we can put your elbows down on the floor and prop yourself up this way. Perfect. So Amanda's lifting up into a front plank. We think this is a really effective abdominal exercise, but again, tough post-pregnancy. The belly could be hanging out, drooping and dropping towards the floor, and you can relax down if you want to. And just simply, we can't control that amount of pressure hanging towards the floor. Gravity is really helping the belly to bulge out, and again, we don't want the belly to bulge out. So we could just be taking too much stress into the lower back, and again, not using the core and the pelvic floor effectively. So that's another variation of exercise we want to avoid, a front plank or a push-up. Something else we want to avoid that seems to make sense early post-pregnancy is holding the abdominal muscles in, tight and tense. So yeah, we can relax you down. So even if Amanda just sucks in her belly, she thinks, yeah, suck it right in, belly button towards the spine. That sort of action, the belly button towards the spine, pulling the abdominals in, because that makes you feel like you're working your abdominals and you're holding your core muscles in tight. We don't want to do that. If we think of a blown up balloon and we squeeze the balloon in the middle, that's that belly button to spine action, we actually get pressure created upwards into her diaphragm and her rib cage, and then pressure downwards into her pelvic floor and her pelvic organs. So if we're walking around like that, belly button to spine, that feeling of trying to fit into a tight dress where you're at a cocktail party all night and you don't want your belly to hang out, we don't want to do that all day long. Again, just creates further issues. We want to allow the belly to relax on that inhale breath, and then we get a bit of tension in the abdominals on our exhale breath. That's how we want to go about our day and our exercises. And lastly, to avoid immediately post-pregnancy, those early days and weeks, is simply being on the feet too much. We want to rest and relax and not be standing a lot of our day or lifting other babies or children a lot of the day, because again, the core and the pelvic floor need some rest and relaxation time. And if they don't get it, we can just have this downward pressure onto the pelvic floor and the pelvic organs and potentially cause some other issues like pelvic organ prolapse that we want to avoid. So resting, feet up, not standing a ton, not tensing the belly in a lot of the day, just allowing the breath to flow and the pelvic floor and the core to get a break by sitting and resting is really effective post-pregnancy. So that is what we want to avoid in the early days and weeks post-pregnancy.